Hello everyone, my name is Clarissa and welcome to DNP Mentor. Today's topic is the topic of self-care. Now I am, as many of you know, a nurse practitioner. I have specialties in both psychiatric mental health and family practice. And so you can imagine that right now in healthcare and really anywhere in the world, any job is stressful. We're dealing with a pandemic. Individuals have kids that are homeschooling from home, something that's different. A lot of people are working from home and at the same time trying to maintain a home and family life. And so it is something that is just chaotic times that we're in. And so practicing self-care means different things to different people. The element in self-care is self. And so what is important to me, what helps me relax, what helps me recover might be something that's totally different for you. So having that awareness, I know that a lot of times people will say things like yoga, meditation, deep breathing, and there is an element to that. Not specifically in those specific activities, but in what they do. So if we think about self-breathing or meditation or yoga, like I had mentioned, it's about being still, taking a moment, taking it all in. So let's try a little activity right now. I want everybody that's watching to close your eyes. Take a moment, your eyes closed. Now take a nice deep breath through your nose. Hold it for about 4 seconds. Let it out forcefully through your mouth. One more time. Wasn't that calming? Just that simple act of taking a moment to breathe. Now, if you're in an area in the country where you have clean air and you take a deep breath like that, it just cleans out your lungs. It adds a different perspective. Now, the other thing about deep breathing is that it makes you still. It allows you just to reflect on the breath. But the other thing is that as you're taking a deep breath and calming yourself, you're slowing down your heart rate and slowing down your thinking. Now, a lot of us don't have a lot of time to just deep breathe all day. But if you take 3 minutes, 2 minutes, and in fact, most of the apps that are out there for deep breathing will have a 2-minute exercise. So 2 minutes a day would make a big difference, just being still. Now, that's an element. Now, for some people, I have a couple of friends that being still creates more anxiety in them. And so for them, getting up, sweeping, mopping, doing something physical does something more to them. So certainly that's something that will work for them. But the key is of being in the moment. Taking that time. So even if you're doing a chore, is saying, okay, I want to sweep my floor. I want to make my bed because when I'm done, I like the way the room looks. I'm going to do this for me because I like to have my environment a certain way. So having that awareness of what works for you is really the key in self-care. Now, there are basic elements, and the basic elements are certainly proper sleep. And that's because we do need a certain amount of time so that our brain and our body can recover for things that we need to do the next day. Absolutely. The other thing is the element of good, nutritious food. Now, I am not an educator in these things specifically, but certainly having the awareness of what we put in our body is something that's important because it's something that will fuel us. Very often, as I'm speaking to patients in my practice, I will do my assessment. And one of the questions that is common is, do you have energy? Do you feel fatigued during the day? And a lot of times people will come in and say, I am just drained. I sleep for 12 hours and I'm still drained. And so before we get into adding supplements or even different activities that they can do to improve their stamina and their energy, you have to go back a notch And you have to look at, what are you eating? Are you skipping meals? Are you eating breakfast? And it's interesting to me how people complain of having no fatigue and they don't eat breakfast. Or they'll eat breakfast and then they won't eat anything until dinner. And what they eat isn't something that's a great choice to eat to begin with. And so, or they'll skip dinner and then they're up at midnight and they're starving and they're eating everything that they can see. And so if you think about the concept of fueling your body, something like that isn't going to do it. So we do have to look at that. And the idea of planning meals, for example, is something very good, because who can think about, if I'm thinking about what I'm going to have for dinner, it might create a little bit of stress. But if I have a planner as to what we're going to eat, what I'm going to make, and I can say, or if I can have a list of choices, then I can just pick one from the list. And the same concept goes with making out a grocery store list of what am I going to eat this week, so that it isn't a stress. Now remember, it's taking care of ourselves. So let's think about some of the things that create stress. So a lot of moms out there, and I was one that I had children, and so busy working mom, and what are we going to eat for dinner? And so it doesn't have to be stressful, for example. So having that, I want to plan it out so that I know we're going to eat every day, so that when the time comes, it just happens. And even if we're going to buy dinner, as simple as knowing what it's going to be. So for me, taking care of dinner was very, very important. Having clothes to wear. Now, not necessarily having my house organized 100%, absolutely not. But if we had food to eat, if I knew what we were going to have for meals, or if we had clean clothes, that was enough for that stage of life. And so knowing your limitations is what I'm getting at. Knowing what you can do. Now, if you are an individual that's used to being in control, you know what COVID-19 did. We have no control. And so it'll create anxiety, but at least pick a couple of things that are still within your control. Can I keep, say, one room in the house organized? So that when you do become stressed and the kids are playing out in the living room and it's a mess, because what else are they going to do? You're asking them to stay indoors. And so where are they going to create the mess? Guess what? It's going to be indoors. And so if you have, say, your bedroom that's organized, you come in, look around, oh, this feels so nice. I like this. Let me take some deep breaths, about 3 of them, and you go out there and you face the day. That is their environment. Now, pick a few things. Knowing what that is for you is the key. A lot of the times, people will just get up, have no plan, it's chaotic, and complain. How does that help us? It doesn't. It actually adds to the turmoil. So let's try to take care of ourselves, our minds, our bodies. Now, the other concept of self-care, just like anything else in life, when you want to improve something, when you want to have something improved, you have to dedicate some time for it. It's not just going to happen because you want it to happen. So think about the concept of weight loss, for example. Just because somebody wants it doesn't mean it's going to happen. And so these are people that have to plan how it's going to happen. In self-care, in generating some peace, something that we have to plan. I'm going to do some deep breathing throughout the day. And it could be when you're in the bathroom. We go to the bathroom several times a day. So make that a routine. You go in, go to the bathroom, and you can say, well, I'm going to do some deep breathing as I'm washing my hands. And now we should all be washing our hands for at least 20 seconds. So instead of singing the happy birthday song, right, you are taking some time to deep breathe, clear mind, and taking that moment and acknowledging that I am taking care of myself. Now, the other concept of self-care are things like promoting growth, establishing hobbies, taking time for yourself. Because we are mothers, we are wives, I'm a nurse, people are teachers, housewives, engineers, and the list can go on and on. We work, we have a house to run, but guess what? Underneath all of that, I'm still Clarissa. I'm still me. And a lot of the times we get lost in our occupations or our tasks that we have to do. So what is it important to me? Now, I know right now, depending on the stage of life that you're in, if you're having young children at home, you can't necessarily work on hobbies. But guess what? You can read up on them, even if it's 5 minutes. You can plan When am I going to be able to, say, practice my piano or work on skincare or do this home project that I want to do? Those are, by the way, my personal hobbies. And so you can do something small. Now, for some people, say, for example, their hobby might be exercise. So for some people, it's either all or nothing. So if they can't go to the gym and work out an hour and a half a day, they don't do it. But guess what? If self-care is important, if exercise is important to me, I can go outside, or I can do something within my house. I can watch a YouTube video and exercise. It doesn't have to be all or nothing. You can do 3 minutes. You can do 5 minutes. And the fact that you're acknowledging that you're taking the time for this is the key. And what happens when we take care of ourselves? We're more calm, we're more at ease, and it actually saves time. So think about if you're calm and you can respond to a situation appropriately. You feel better. You act better. You're not yelling as much. You're not stressed out as much. You go to bed and you say, wow, I handled that situation better. Or I really liked dinner today. And that's because you had a plan on how that was going to happen. I really liked the way bedtime went. I wasn't as frustrated. We know that some kids, and I had one that hated to brush his teeth. And it would be a chore every single night. He was about 3 at the time. And so knowing that it was going to be turmoil, now what I have learned with experience is that, okay, prepare for that. If I am calmer when we're going to go into the situation, if I'm not as stressed, if I took the time to self-care, I'm going to handle that better. And I'm not going to add any more turmoil to the situation. So that's really the concept. I hope that you enjoyed today's video presentation. Please take the time to like, subscribe, and make a comment. If you could write in something that may be a topic related to mental health that you want me to speak about, I will take my time to read it and respond. Thank you so much. Have a wonderful day.